One of the Obama administration's stated objectives for healthcare reform is for healthcare providers to start using electronic medical records. To that end, $2 billion was set aside in the American Recovery and Reinvestment Act to help hospitals, doctors' offices, clinics, and other medical support and service providers to make the switch. For Oklahoma Community Health Services, electronic records would be able to connect the various doctors who treat a single patient.
The medical record is in a paper chart in some doctor's office, and the other doctor doesn't have access to what's in that chart, then the other doctor, whoever that may be, isn't going to be able to practice at the highest level because they don't have all the information that might have been missing.
Now that federal stimulus money is being made available, Oklahoma health officials want to come up with a way to attract that money to the state. So they're bringing all facets of the medical community together to come up with a comprehensive plan.
We need to be doing it in a coordinated fashion. It is not going to work in the state of Oklahoma if we have 12 different plans. And in fact, if we want to qualify for several of these funding streams, we have to show that Oklahoma has a plan to have a single plan in the state of Oklahoma at some level.
The officials are acting because of the nature of the stimulus plan. The funding will only be made available for a short time, so the planning for Oklahoma's electronic medical record system must begin now.
Everything is accelerated, and that's why we as a state, beginning today, have to come together and figure out how we can best collaborate, meeting broad interest to optimize, maximize the benefit to the state of Oklahoma and to the citizens of Oklahoma.
According to the members of this panel, the key to making electronic medical records work is to create a health information exchange where those records can be accessed by the physician treating a patient, the labs conducting the tests, and by other health service providers.
One of our biggest goals is to defragment the medical record and begin to bring that together into one place. And it's cost effective.
The panel agreed that by going to a health information exchange system for electronic medical records, it would eliminate the duplication of tests and give doctors a comprehensive record of treatment to prevent prescribing the wrong medications. The health officials will continue their work so that the state's medical providers have a better chance to score federal money for an electronic medical record system. From Oklahoma City, Jason Doyle, the Oklahoma News Report.